Hi, this is Hilary Baldwin. I've been asked to comment on a recent article by Karlin and coworkers out of South Carolina. They did a small study of 19 patients with moderate acne, and they treated them only weekly with isotretinoin, 1 to 1.5 milligrams per kilogram, for about 4 months. And what this means was that the patients got somewhere between 16 and 24 milligrams per kilogram total dose. So what was interesting about this, the purpose of this study, was the opinion that we all share that people are on antibiotics far too long. Nagler in 2016 showed us that the average patient who ends up on isotretinoin received 1 to 1.5 years of antibiotics. And of course, patients with moderate disease are also often treated with hormonal therapies with their incumbent side effects. So the concept here was that lower dose isotretinoin results in fewer side effects and higher patient satisfaction, that it would get us away from antibiotics and hormonal therapy, that lower doses are actually cheaper, and that patients are more satisfied overall. And some studies that looked at mild to moderate disease in the past have indicated that a small amount of isotretinoin is just as good as a large amount. Now, the follow-up in this study was only 2 months, and that's one of its major problems that I see. 95% of the patients got better. 66% of them were clear or near clear at the end of the 4 months. Very few had side effects, and laboratory values were normal at 2 months. The major problem here, as I see it, is that 2-month follow-up. In order to really tell whether somebody's going to recur, we need to go much longer than that, 6 and maybe even 12 months. Additionally, as we're well aware, moderate acne is technically not part of the FDA-approved use of isotretinoin, which is reserved for severe nodulous cystic acne. I also fear that maybe this is a little bit too casual, this use of isotretinoin, and that the relapse rate perhaps would be higher, and in female patients that this might be a problem. So although I agree with them that this is another option for our patients with more severe disease, personally, I'm a one and done kind of person, and I'm probably going to stick with the higher dose still.